Well, hello there. This is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is about what method should I use to improve talking, or we could even say, are the methods that are being used with my loved ones, are they effective for aphasia or apraxia? Okay, so that's a very interesting question. I see a lot of people who have been through traditional speech therapy. They've been through traditional approaches, and many of them have found a lot of difficulty with the methods that many speech therapists are currently using. One of the things that caregivers frequently tell me is that the technology that is being recommended to them is too difficult, too complex, and that the person with aphasia or apraxia really doesn't like working with technology. Number two, other caregivers who have contacted us have told me that they just didn't like the method of therapy where they were saying, see the picture, find the word, or see the word, find the picture. They find extreme difficulty understanding that and equating how an exercise like that would help the individual with speaking. And then there are others who are working with various different kinds of cognitive therapies where speech isn't even addressed. And many of these caregivers are saying, what's going on with speech therapy? Quite often they're not even addressing speech and language and how to help the individual with aphasia or apraxia speak. So those are some of the challenges that I believe people with aphasia and apraxia face. So here's what I'm suggesting. I'm suggesting that if you're going to work with speech therapy and your loved one, if your loved one has apraxia, then you must focus on helping them produce the sounds of speech. Now, with apraxia, there's a certain sequence of sounds that you must address, and quite often they're not related to whole words, because if a person has a severe to profound apraxia, they have difficulty saying whole words. So what you can learn with the apraxia methods that we use with the teaching of talking is how to help your loved one produce the sounds of speech that are necessary to build words. All right? Then, once an individual has mastered how to produce the sound of speech again, then you find the words that include those sounds that you're working on, and you practice saying those sounds. And then you practice the words that include those sounds that you are working on. It's very simple. If they have trouble consciously producing the sounds of speech to make up words, and they can't say words, then you've got to break the words down into sounds. Once you do that, then you must work on those sounds that are the easiest for the individual. And once they can produce certain sounds, then there's a method to choose words that are functional for that person, that are appropriate for that person, and teach those words to that individual. And in that way, you'll find that the individual will be able to start saying words. And when an individual with aphasia or apraxia starts saying words, gosh, what a rush of good feelings, positive feelings, and self-confidence. Now, that's if you have apraxia. Now, if you have aphasia, you have to find out what the person with aphasia is capable of. Are they capable of repeating single words? Yes or no? If they're not, chances are they have apraxia. If they can repeat single words, then what you need to do is find a method that helps you teach those single words to the individual with aphasia. And in that situation, the situation is typically related to a Broca's aphasia if the person can produce sounds. Once you teach a person how to produce single words in aphasia or apraxia, then the idea is to then expand the number of words to 2 words, and then to expand to 3, and then to 4, but doing so very slowly and very sequentially. So start looking at the type of therapy that your loved one is getting and ask one simple question. The question is, does this therapy seem to me like it's going to help the person or my loved one speak again? If you have questions about that, or if you're doubtful that what they're doing in therapy is helping, then reach out to us. We have a link below here that you can call and set up a free get acquainted consultation with me, and we can discuss some of your concerns. And we're doing that as a public service and as a way of introducing you to a method that we've been using for, at least 50 years and getting quite good results with. So on that, I'm going to wrap it up and say I hope you liked this video, and if you did, give us a thumbs up. And down below are the links to our website so that you can look at some of our materials. Down below is also a link if you'd like to set up a free Get Acquainted visit with me. So we're looking forward to communicating with you in the future and helping you with whatever speaking challenge you may have. So this is Mark Edelman. Have a great day. Have a great week. Have a great month. Have a great year. And of course, have the best lifetime that you can possibly have. Thank you very much. And bye-bye now.